All right, so today we're going to talk about COVID-19, what we know so far and planning for the future. A lot has happened since Thursday, so we have a lot of new slides today. For those of you who've never been on this presentation before, my name is Dr. Valda Crowder. I'm also known as Dr. V. I've been an emergency medicine physician for 30 years. I've treated patients through 3 pandemics and 2 Category 5 hurricanes. The documentation and the source documentation is at AskDrV.us. And you can also follow me on Twitter, AskDR_V. All of these presentations are taped, not including the Q&A, just the actual presentation. And they're on YouTube and on my website, right? So you don't have to take you don't have to take any sort of notes or worry about the slides or anything like that. You can also always access the information, and all of the presentations are actually dated. All right, so let's talk about the structure. The structure is 10 to 15 minutes presentation and then 30 to 45 minutes Q&A. So it'll be about an hour from beginning to end. In order to ask questions, everyone initially will be in listen mode. And in order to ask questions, you have to actually write them in the Q&A or actually write them in the chat box. I'm going to actually take written questions first. And when people actually also send me questions after the presentation, then I actually incorporate those slides and the answer to those questions as slides in the next presentation. The intention is for webinar participants to be informed about COVID-19 that will help them and their families stay healthy during this pandemic. You'll leave the webinar motivated to create an action plan for yourself, or you may be interested in creating an action plan for a broader community, like a union or a school or a homeowners association or a work site or something along that line. All right. All right, I wanted to just talk about quickly other pandemics, right? Because we're dealing with a lot of leaders impacted by COVID, right? And this slide is just sovereign leaders that were killed by smallpox, right? And as you see, they spanned from Russia to Sweden to France to Austria to Egypt. So there really is a national security component of all pandemics, particularly when they impact a particular country. Now, when we look at world leaders who have had COVID-19, we're dealing with Boris Johnson, the Brazilian president, Prince Charles, I've listed them here, and now recently, the US President, Donald Trump. Now, I've talked about the fact that COVID-19 is highly contagious. Minimum time of exposure is 45 seconds. You all have seen this slide before. I'm actually going over this slide and another slide for a very specific reason. Percent penetration, if 100 people are exposed, 60 to 80 of them will become positive, as opposed to the flu, which is like 30 to 35%. It is a droplet disease, but it is also an airborne disease, which means that it can go further than 6 feet, okay? It depends upon how it's actually transmitted. So is it transmitted through like certain things like singing or instruments actually make it go further? That's why indoor church service and things like that are very problematic, right? So this is just a diagram that shows a droplet disease in the red and an airborne disease in the gray, right? So COVID-19 is doing both. It's doing what you see in the red. It's also doing what you see in the gray, right? It's going beyond 6 feet. All right, so let's take a look at actually what happened, right? So this was a super spreader event, which was the Rose Garden event that happened last week. You can see that almost nobody is wearing a mask. People are packed in pretty tightly. They're not sitting every other chair or anything along those lines. Now, if you look at it actually closer, then this actually shows who the people are that became positive, Now some people are still becoming positive. So there's some people in this slide that have recently become positive since this picture was actually taken, right? President Trump and Chris Christie were actually hospitalized, right? And Kellyanne Conway has actually, she has, I don't know, 4 or 5 children, but she has given COVID-19 to her daughter, Claudia Conway, right? So this kind of just shows, you know, what the event actually looks like. And let me actually, standing next to President Trump is the Supreme Court nominee, I think it's Amy Barrett. So just so everybody knows, she had COVID-19 in June, right? So she had a recent infection, which means she probably still has antibodies. So that is why she did not become positive. So most people are talking about this Rose Garden event as a super spreader. So this Rose Garden event was not the super spreader. What was the super spreader was all of the VIP receptions and photo ops that occurred indoor before this event. So I want to go over this. Here's what occurred prior to the outdoor Rose Garden event. So there were some photo ops, there were some receptions. I mean, I'm just really shocked. The woman there in gray is Antonia Scalia's wife. I mean, she's probably the most elderly person in the room with no mask. There is, in the right here, Chris Christie talking to Amy Barrett and her son. Here's some more events that are very, very close, very, very intimate. So these are all the things, this all happened prior to, right? So given that these receptions were prior to, I actually think these receptions were the super spreader event, not the outdoor Rose Garden event. All right, so now we had talked before about how do you make the diagnosis of COVID-19? We talked about PCR, antigen, and CT testing, okay? So the PCR testing is a little bit more invasive. The antigen testing is the rapid testing. So basically what happened is President Trump had a rapid test that was positive. They wanted to make sure it was positive, and it was followed up with a PCR test, which was also positive. So when he went to the fundraiser and they said that the test, he was waiting for the results, that's the PCR test because that's not a rapid test. So he had already had a rapid test that was positive, went to the fundraiser in Bedminster, New Jersey, and then had a PCR test that was also positive. Now, I've talked a lot about how you really need to look at a CAT scan. So the reporters have asked a lot about what did his CAT scan show, and nobody's talked about the results of his CAT scan. And they haven't talked about the results of the CAT scan because the CAT scan actually shows that you actually have viral pneumonia. And specifically, it shows that by ground glass opacities and linear opacities in the pleural space, but it can also be in the subpleural space. So I'm sure he's had a CAT scan. We just don't necessarily know the results. But let's talk about the symptoms. We've been really, really clear. There was coughing, he was short of breath, and he was fatigued, right? There's a lot of conversations about him being very, very tired, right? So we've talked about previously in our webinars about the 6 clusters of COVID-19 symptoms and how these 6 clusters actually predict the severity of the disease. So you've seen this slide before. So now let's go over what those 6 clusters are. Remember, cluster 1 was flu-like with no fever. Now we know he had a fever, cough, shortness of breath, and fatigue. Cluster 2 is flu-like with a fever, okay? Cluster 3 was gastrointestinal. He did not have gastrointestinal symptoms. Cluster 4 is severe. That is the level where you have headache, loss of smell, cough, shortness of breath, and fatigue. So President Trump was level 4. Cluster 5 is actually where you have confusion, and cluster 6 is where you actually have everything. You have confusion, fatigue, respiratory symptoms, abdominal symptoms, a little bit of everything. So now even though you can present with a cluster 1, and then you can actually move into a cluster 4 or a cluster 5. You can present with a cluster 4 and actually move into a cluster 5 or cluster 6 as the disease progresses. So what you initially present with doesn't really say where you're going to go. I would say only out of all of these clusters, really, if I see somebody who presents with GI symptoms, nausea, vomiting, diarrhea, those people normally sort of stay in that cluster and don't do that bad. So he was cluster 4. Cluster 4 is one of the 3 clusters, 4, 5, and 6, all of which can actually have a pretty bad outcome. So let's talk about his treatment. So a pulse ox was used. We've talked about having a pulse ox, the importance of having a pulse oximeter at home, and how cheap they are and how you can get them on Amazon for about $30. We've talked about if your oxygenation level is less than 95%, then you need to go to the emergency department. The president's was low 90s and also into the 80s. He was also given vitamin D and zinc. We've talked about the importance of vitamin D and zinc on these presentations. He was given famotidine. I'll talk about that. He was given dexamethasone, which is Decadron. I'll talk about that. And then he was given remdesivir. And then people keep talking about Regeneron. So Regeneron is not the name of the medication, but I'll talk about that as well. So let's start first with famotidine. Fancy name. All it is Pepcid AC. Okay, you can buy this in the drugstore. Okay. So Pepcid AC blocks histamine release. It's been associated with lower in-hospital deaths, and it also has been associated with a lower incidence of combined deaths and lower likelihood of intubation. You can give it in a PO form where somebody can take it by mouth, and you can also give it in an IV form. So that's famotidine, okay? Now, dexamethasone or Decadron is a steroid, right? You give dexamethasone and remdesivir in people that you know for sure have viral pneumonia. So the fact that the president got this, we know for sure that he had viral pneumonia and that his CAT scan is actually positive for viral pneumonia. We know that for sure because he was given both of these medications. Usually remdesivir is saved for people who are actually in the ICU, in the intensive care unit. Dexamethasone, you give it to somebody who's, not doing well on the floor and heading to the ICU. So the fact that both of these medications were given, actually, we know for sure that he had very bad disease. Dexamethasone lowers the 28-day death rate for patients that require oxygenation or ventilation. It has no clinical effect on anybody who is not already on oxygen or not on a ventilator. So the fact that dexamethasone was used, the president was either requiring oxygen. We know he wasn't on a ventilator, but he most likely was requiring oxygen. Remdesivir. Remdesivir is an antiviral medication. It was initially developed to treat hepatitis C and RSV. I've talked about RSV before, which is respiratory syncytial virus. RSV and influenza are important because they increase their incidence in the wintertime. And this is why I've been recommending that everybody get a flu shot, because the flu shot will help with influenza. There's nothing to help with RSV, but the wintertime is going to be worse because people are going to get COVID and influenza or COVID and RSV. So anyhow, remdesivir is an antiviral drug that blocks the replication of the virus in your body, okay? Let's talk about how COVID replicates in your body. So first, the virus enters a cell, right? Then what happens is it releases its genetic code. So the COVID-19 has a genetic code. China gave us that genetic code in January of this year, January 9th or 10th or so. They said, hey, there's a pandemic coming. Here's the gene sequence. for this actual virus in January, right? Once it gets inside the cell, the genetic code converts to proteins, to viral proteins, and then those proteins begin to make copies. And they copy themselves and copy themselves and copy themselves and copy themselves. And this is how COVID actually replicates in your body. The virus then gets assembled, and this is how you have the infection over and over in all of your different cells. So remdesivir actually blocks the replication of the virus. And that is what remdesivir does. So if somebody has an infection that's going and going and going and going, and it seems to be getting out of control, you give them remdesivir, and Decadron blocks the inflammation. Now, Regeneron, they keep talking about Regeneron. Regeneron is not a medication. Regeneron is the name of the company, okay? So when these medications are in an experimental phase, they don't have a name. They usually have a number, okay? So they're referring to it now as an antibody cocktail, but it has a number to it. I don't exactly know what the number is. So Regeneron has a medication that has not yet been named that is an antibody cocktail that they're doing experimentation on. So they decided to actually give this to the president. So what is this? It's 2 antibodies directed at key proteins that are on the surface of the virus. The first antibody comes from a human that has recovered from COVID-19. The second antibody is from a mouse, and it was re-engineered to have a human-like immune system. Both of these antibodies actually bind to the main surface spike protein that the virus actually attaches to, which I showed in the other picture, to a receptor human cell, and it blocks that attachment. So that is how Regeneron actually works. Now, we have not studied Regeneron used in conjunction with remdesivir, used in conjunction with dexamethasone, used in conjunction with famotidine. So they basically threw the kitchen sink at the president because I think he was so sick. So now let's talk about serum markers, because you've heard the reporters say, well, we haven't seen the CAT scan, and we also we don't know what the serum markers were, so we don't know how sick the president really was, right? So I wanted to kind of go over what exactly are they talking about. So one, they're talking about the white blood cell count, which would be high in an infection. The other thing is that you have different types of white blood cells. So you have lymphocytes, and in COVID-19, the lymphocytes are low. You also have something called a C-reactive protein. C-reactive protein would be high. A C-reactive protein tells you how much inflammation is going on in your body, right? And so histamine release and all of that is inflammation. So a C-reactive protein would be high. Procalcitonin levels, those also would be high. D-dimer, very, 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 very important. D-dimer tells you how much is my blood clotting. As we know, in COVID-19, we have problems with clotting. So we have people having strokes, they have heart attacks, they have renal failure, they have leg amputations because their blood is clotting. So the D-dimer tells you the D-dimer is high when your blood is really clotting. So that's the value of the D-dimer. All right. So then we had the president go meet his fans in this SUV. So what I actually really want to focus on in this actual slide is not the president, but the person that's in the front seat. And I want everybody to really take a look. He has on a mask, I don't know, and he has on this little flimsy yellow thing, and then I don't know, that's really about it, right? So the president here is COVID positive. The Secret Service, there's 2 Secret Service agents in the car. One is driving and the other one is in the passenger seat, right? We don't see the one that's driving. But I want to go over what is the amount of PPE and what do you need to do to properly be around somebody who's COVID positive. All right, so this actually shows somebody getting dressed, and this is in China. They do we do some of this. I can't say we do all of this. They do a way better job than we do. But I want to just show what does it actually look like to actually get dressed in proper PPE to actually be in the room with COVID. So they're all getting dressed before going to actually be in the room with COVID patient. That's a surgical gown. The blue gowns are surgical gowns that are very, very thick. The yellow gown that you saw the Secret Service agent in is a very, very thin gown. Now she's putting on her gloves. This is very important. She's putting on shoe coverings. That was shoe coverings. You didn't quite see that. Now what she's actually ripping it over, this is basically what we call a Tyvek suit. She's putting a Tyvek suit on over her surgical gown. So I actually have my own Tyvek suits. I bring them to, and these are disposable. So when you get done with one patient, you actually throw them out. This is another booty. Now my Tyvek suit have booties. This is another booty that she's putting on that actually goes up like to her knee. So there was a booty that kind of went up to her ankle, and now there's a booty that goes up over the ankle to about the knee. Now she puts another hairnet over. Again, this is because COVID-19 is so contagious, right? So I want you guys to really see, this is what it actually really takes to be in the presence of somebody that's COVID positive or potentially COVID positive. So she's doing the double gloving. The other one went under the Tyvek. This one goes over the Tyvek suit. So there's a particular procedure to it. She's doing additional booties. She's doing another mask. Now she's putting on her goggles. All right, great. And if you're actually doing something in an ICU, then you're actually putting an active ventilation unit on top of all of that. So I just want to go back to the slide again. Look at the Secret Service agent. He doesn't have anywhere close to that type of PPE on, and it is really, really problematic. The Secret Service agents are really going to get COVID-19. All right, so let's talk about, you just found out you had COVID-19. Let's talk about what we need in our rooms. I talked about a pulse ox. I added a picture here to the right so you can see how it actually works. SpO2, which is the first line, is the hemoglobin saturation. That is the thing that needs to be higher than 95%. Some of them also tell you how PR is pulse rate, which is basically how fast your heart is beating. those are really, you really only need the SpO2. You don't need all the other monitors, all the other things for an at-home use. Zinc and vitamin D3, just like the president got it, you should get it. If you want to get some Pepsid AC, you can. You'd have access to a bathroom that only is used by you, your cell phone, food. People leave food at the door. You want to keep the windows open, and you also want to have a HEPA filter. Also, quarantining. So again, about 6 to 10% of people after a 14-day quarantine were still positive. You want to preferably do a 21-day quarantine. That's what we found, that afterwards everyone is negative. If you do a 14-day quarantine, then I would suggest that you get 2 rapid tests or 1 PCR test back that is negative. We also have recently had top military leaders. There's a Coast Guard admiral that tested positive for COVID-19. This happened actually, I think today. This happened today. So now Joint Chiefs of Staff are quarantining. Pandemics are national security issues, okay? So a pandemic, it's an economic issue, it's a medical issue, and it is a national security issue. You have to have medical people involved in all of that planning, because once it gets out of control and it begins to actually impact a country at this level, it's a whole different conversation. And so I think this is really, really important. All right.